Hello. Benzodiazepine withdrawal syndrome is an iatrogenic illness that is largely unrecognized and or misunderstood by the medical community. It's estimated that 40 to 80% of people prescribed drugs like Xanax, Ativan, Valium, and Klonopin can experience the very debilitating mental and physical effects of this iatrogenic illness. Hi, my name is Jocelyn, and I was prescribed Ativan 4 years ago for sleep. To learn more about how and why this happened, please watch my first video entitled Ambien to Ativan and Tapering. But for today, my hope is to be a voice for the thousands and thousands of people suffering from benzodiazepine withdrawal syndrome. As I mentioned, many of us are so mentally and physically disabled, we're unable to advocate for ourselves. My hope is to be an advocate today. To validate the information that I'm going to be providing here, I'll be providing citations in the form of pop-ups on the screen to medical journals, research, peer-reviewed studies, things like that, that can be found down below this video. So let's get down to it. What is benzodiazepine withdrawal syndrome? From the research that's been done, what we understand is that we are suffering from a phenomenon known as GABA downregulation. This is basically where the GABA receptor is literally absorbed back into the neuronal axon, and we're no longer able to utilize GABA. As many of you know, GABA is one of the body's main mechanisms for calming oneself down, tranquilization, helps people get to sleep. And when you no longer have GABA receptors that are functional, this mechanism just simply doesn't function. So imagine that you've had just a terrible, horrible nightmare, and you wake up from this nightmare and your heart is racing and you're sweating and maybe you're shaking a little bit, but you get up, it's not real, so you take a few deep breaths, maybe grab a drink of water, and things calm back down. Well, for those of us who have benzodiazepine withdrawal syndrome, we're not capable of doing that. So this illness at its worst is basically like living in a constant state of fear and panic 24/7. If you also recognize that not only is GABA intricate in almost every aspect of brain function, but it's located throughout, it's estimated about 70% of a person's body, there are a whole host of physical symptoms that are present as well. And some of the symptoms that I have personally experienced or am currently experiencing that I know I share in common with other people in the benzo withdrawal community are as follows: severe joint and muscle pain, hair loss, and various skin disorders, disorientation, insomnia, tachycardia, POTS, akathisia, tardive dyskinesia, burning sensations, depersonalization, derealization, symptoms of IBS and Crohn's, cortisol surges, memory loss, tinnitus, chronic fatigue, monophobia, and agoraphobia, various phobias, intrusive thoughts, auditory hallucinations, myoclonic jerks, twitches, symptoms basically of a severely compromised central nervous system, along with severe weight loss and chronic infections. Now, this list, to those who are not familiar with benzodiazepine withdrawal syndrome, may seem a bit exaggerated or almost impossible. But if you understand where all GABA receptors are located, they're in the stomach, they're in the liver, they are found in immune cells, bone cells, endocrine tissues, reproductive tissues. It actually makes sense in looking at it from this perspective, that the potential repercussions for not having enough GABA in someone's body are almost infinite. So who is at risk for benzodiazepine withdrawal syndrome? Well, anybody who uses these on a daily basis is at risk. I know that the safety guideline is 4 weeks. A lot of warning labels say to not take this longer than 4 weeks. Well, there are many, many people who only take these for 4 weeks on a daily basis who experience GABA downregulation. In fact, the shortest that we know of is someone who's on it for 9 days and is experiencing or has experienced benzodiazepine withdrawal syndrome, which can last normally anywhere from 12 to 24 months. Children are particularly at risk for this because their bodies are growing, their metabolisms are changing, so they're at much greater risk for developing tolerance much sooner to these drugs than an average adult. Again, I know many parents whose children were put on these for seizures, and it took them years sometimes to realize that the symptoms that their children were experiencing were not the effects of having seizures, but actually the effects of benzodiazepine tolerance and withdrawal syndrome. It was reported recently in a news broadcast that there are 274,000 infants between the ages of 0 to 1 that are on prescription benzodiazepines. I'll provide a link to that as well. People who have cold turkeyed are particularly at risk not only for benzodiazepine withdrawal syndrome, but something that's known as PAWS or post-acute withdrawal syndrome. This means that their symptoms are more severe and last longer. So instead of 12 to 24 months, 12 to 18 months, it could last 24 months or even 3-4 years in some cases because of the manner in which they withdrew. Also, please remember that people who detox off of these drugs are basically experience the same symptoms as those who are cold turkeyed, because it's 4 weeks is just simply not a long enough time frame for people who have downregulated GABA receptors. So the reason for this increase in severity and time frame for withdrawals for people who do cold turkey or detox is because of something called kindling. So kindling is anytime somebody takes a substance like alcohol or a benzodiazepine, which affects GABA receptors, and then they cold turkey from it, the next time that they get back on a drug like that, their risk for increase in severity and symptoms and duration and so forth it increases exponentially. So they are much, much greater risk for developing an iatrogenic illness like this. So it's imperative that doctors understand that people who are on these medications who maybe are still taking them regularly and haven't even attempted to withdraw from them could be experiencing the symptoms of GABA downregulation. If a patient presents with a worsening of symptoms or new symptoms, no matter how unrelated those symptoms may seem, it's extremely important to look at the drug as the potential source of the problem and not to blame the patient. So that leads me into what can be done for people who are suffering from benzodiazepine withdrawal syndrome. The first thing, obviously, is to become educated. And many different researchers refer to Ashton, who is the world's leading authority, still is, on benzodiazepines and withdrawal. And what she found in her clinical trials is that a 10% Valium reduction seemed to be the most humane and safe way to taper people off of benzodiazepines. This means that people that are on shorter acting benzos would need to spend a period of 4 weeks crossing over to an equivalent amount of Valium and then reducing that amount by 10% every 4 weeks or so. This doesn't mean that 10% is a hard and fast rule. She has that as a suggested guideline, and people who are tapering off of this need to be allowed to taper at a rate that is comfortable for them. Comfort being a relative word, since either way there's just going to be a lot of pain and suffering that goes into this. It's also important that people who are still trying to taper off these medications have access to medication that is easily tapered. A lot of us are doing this on our own. People are trying to use a razor and a scale and cut their medications that way, or a lot of us are doing various forms of liquid titration where we actually put our pills and dissolve them in water and pull little bits out at a time. For those of us with shaky hands and foggy brains and poor memories, it would be such a relief to have access to a liquid form of medication that is easily tapered. And unfortunately, the form of Valium that is usually ordered from the pharmaceutical company, it comes in an alcohol solution. I myself tried to take liquid Valium and had a very, very poor reaction to it. It only makes sense. Any warning label that you read says not to mix benzodiazepines and alcohol. And yeah, so there are actually a lot of compounding pharmacies to which people have access, and that would be a great way to provide people with a form of powder Valium that's mixed up in an almond oil solution that people can use to taper. I'm also reminded of the Hippocratic Oath, one of the covenants in there, that says to not fall into the twin traps of over-medication and therapeutic nihilism. When it comes to people who are experiencing benzodiazepine withdrawal syndrome, we're going to present a lot of symptoms for which there are a limitless amount of medications that we could be prescribed. But there needs to be a lot of caution used before prescribing anybody going through this, any kind of medication, particularly psychiatric medications. For many of us, this condition is relatively temporary, 1, 2, 3 years. So you have to weigh the risks of treating a symptom that is a result of GABA downregulation that can only heal when our GABA receptor is upregulated, versus giving us another medication that could possibly interfere with that or cause us to have a terrible reaction. Because we have central nervous systems that are so extremely sensitive, even foods and things like that can set us off, cause us to go in what we call waves, where our symptoms are magnified, and it can last for days or weeks before we sort of go back to our normal baseline of what's normal for us. So please use extreme caution. Also, fluoroquinolones, we're known to have extreme reactions to fluoroquinolone antibiotics, and they needed to be avoided at all costs. The other thing that is important for those of us who are suffering from this is that doctors believe us. Not only do we need the validation from the medical community, but we need this to be documented in our medical records. We need this to be recognized so that there is a call for more research into this, so that we can find therapies or medications that can help to alleviate some of our symptoms and make this less of a torturous process. And of course, don't assume that because a patient is having difficulty withdrawing from a benzodiazepine that they're an addict. In fact, GABA downregulation has absolutely nothing to do with addiction. Another important way in which doctors can help those of us in the benzo withdrawal community who are suffering long-term is to provide people with access to disability. This means amending their medical charts so that they have those diagnoses, those medical diagnosis codes in there that they can use to apply for disability. Because most of us at some point during this are not capable of providing for ourselves. We're not capable of working. We're not capable of interacting with people even online. We can't read. We can't watch TV. It's very, very debilitating. And I've just witnessed far too many people who have lost so much due to this illness. It's also helpful and necessary that we have access to therapies like cognitive behavioral therapy, mindfulness therapies, just things that will help our brains to rewire correctly as they're trying to heal and the GABA is upregulating and the receptors are upregulating. This can be difficult as it's difficult for so many of us to drive. So many of us are just bedridden, homebound for various reasons. So what would be most helpful is to have access to therapies that are online or via Skype. That's also very helpful. And also encouraging people going through this to join support groups can be life-saving. It can be also very cost-effective for both the patient and the ERs or the doctor's offices because, as I mentioned before, we experience a multitude of symptoms which can be very enigmatic and very frightening. And of course, while we still encourage people to get their symptoms checked out because you never know what could come up during this or what infections we may have, things like that, most of the time what we find is that these symptoms are all normal symptoms of GABA downregulation, no matter how severe they are, that with time they do go away and we do heal. And so we need to be reminded of that daily, sometimes on an hourly basis, instead of going into the ER every time we feel that there's, that we're experiencing these severe symptoms. I don't wish to paint a picture here that is bleak in any way. I know basically what I'm saying is there's not a whole lot that we know of that can be done other than time and support for people who have benzodiazepine withdrawal syndrome. But what we really could use during this is hope. We need to have hope that there's going to be a change, that this won't continue to happen to so many people every year, that there will be an open dialogue between people who are prescribed these and doctors and the pharmaceutical industry and society, not only to bring awareness to this, but also to consider phasing out these drugs altogether when it comes to daily therapeutic use. Because, as I mentioned before, if 40 to 80% of people are potentially at risk for being this severely disabled, we really need to start weighing the risks versus the benefits of these drugs. Not only the implications that it has for the people to whom it's prescribed, but also to their families, to societies. Is it ethical to prescribe a drug that can cause so many people to be unable to work, people to be unable to care for their children, and to be unable to care even for themselves, and that need disability? Are the consequences of that worth it? I really want to put that question out to you today. Is it worth it to prescribe benzodiazepines? Thank you for watching.